This is a presentation on Alzheimer's disease by Caitlin Beckett, Alyssa Besson, Jenna Hines, Katie Klein, and Sarah Mongen. So what is Alzheimer's disease? In 1901, there was an unusual case where a client had difficulty sleeping, disturbed memory, drastic mood changes, and increasing confusion. After an autopsy was done, there were visible differences found in the brain tissue, such as a misfolding of plaques and neurofibrillary tangles. The plaques, tangles, and proteins destroy the ability to process logical thought, control emotion, cause paranoia and hallucinations, and destroy long-term memory. Eventually, the centers controlling heart rate and breathing are overpowered, resulting in death. These are pictures of a normal brain compared to brains with Alzheimer's and the damage that occurs. This is another image of a brain with Alzheimer's, and in this picture you can see the cortex shrivels up, there's shrinkage, especially in the hippocampus, and the ventricles grow larger. Please view this video if you would like to see what it is like to have Alzheimer's.
We have found a clip that depicts how devastating Alzheimer's disease can be. To truly understand just how catastrophic an illness Alzheimer's is, consider that it is the only cause of death among the top 10 in the U.S. that can't yet be prevented, cured, or even slowed. Someone diagnosed with cancer, heart disease, or even HIV/AIDS has a better chance of surviving and having a better quality of life while battling the disease than a person diagnosed with Alzheimer's. Here are some facts and figures about Alzheimer's disease. 5.3 million Americans aged 65 and older live with this disease. The direct cost to the U.S. economy, $226 billion. In 2014, friends and family of people with AD and other dementias provided an estimated 17.9 billion hours of unpaid care. Every 4 seconds, someone is diagnosed with Alzheimer's disease. Almost 2/3 of Americans with Alzheimer's disease are women. It's the most common dementia. Alzheimer's disease is the 6th leading cause of death in the U.S. 1/3 of seniors die with Alzheimer's disease or another dementia. There is still no cure. As we have learned in class, a patient diagnosed with Alzheimer's disease can have difficulty with word finding and gathering their ideas and thoughts. Our activity will consist of reading a passage and explaining it to another person without using specific words in the passage in order to elicit a frustrating, stressful conversation between the patient and caregiver.
Go to a place where they keep all of my bills and coins.
Do you need to go to the bank?
Yes, I need to go to the bank.
Okay.
At the bank, I need to get a certain amount of money back. I need to get those bills. They're worth a lot of money, and I need multiple of them. Not only 2. I need more than that.
Okay. Do you need $20 bills?
No. More than that.
$50 bills?
More.
$100 bills?
Mm-hmm. Yep, I need 100.
Okay.
But I need a few of them.
Do you need 3?
Yes, I need 3. But when we go to that place with all the stores, I need to find some certain things. I need something to put on top that has buttons on it.
A shirt?
Yep. And I need something to wear over my legs.
You need pants?
Mm-hmm. And I need something for winter when it's snowing.
You need boots?
Nope, something to wear over me.
A coat?
Mm-hmm. But I want one that's a dark color.
Do you want a black coat?
Yes, yep. And then after we go there, I want to go somewhere to get food. And I want to go to my favorite place to eat. It's the name of a bird and a color. Um, the place, it starts with a color.
Red Robin.
I want to go there.
Okay.
Okay, now we're going to go through a case study on early onset Alzheimer's with a client named Donna Baker, who is 50 years old and was diagnosed at age 48. She's currently living in a precious and small time period between the Donna that she used to be and the Donna that will no longer remember her. She reached out to a reporter for the Arizona Republic and asked her to tell her story. Before Donna's diagnosis, she spent 20 years in banking, handling as many as 10 mortgage loans a day, with paperwork inches thick. She loved to read, often finishing a book in one day. Donna had a great memory. Her husband states, "She was my memory." He could ask her the name of a doctor he had seen 2 years prior, and she could give him the name, phone number, and address of the office. Pictured is Donna and her husband, Nick. After her diagnosis, Donna has trouble getting up and going to the bathroom in a restaurant and not being able to find her way back to the table. She can no longer add a simple column of numbers, and she cannot follow a storyline for more than 3 paragraphs into a novel. Donna says, "It destroys who you are and everyone around you. It kind of takes away everything that makes you you. I am losing my life with my husband. He's losing me a little at a time." Donna's husband, Nick, first noticed problems about a year prior to her diagnosis. Donna began to ask Nick for information that she usually had to tell him. She began to get lost while driving on trips that she had made hundreds of times. Nick wanted her to go to the doctor, but Donna did not think she needed to. A vision test first showed that something was wrong. Her field of vision was narrowing drastically. The doctors could not find the source of the problem, and Donna was sent to a retinal specialist. Still no answers were found, and she was sent to a neuro-ophthalmologist who conducted an MRI to rule out a blockage, tumor, or aneurysm. On the possibility of having a blockage, tumor, or aneurysm, Donna states, "You'd almost welcome that, something treatable. I would have thought, okay, I've got a shot with that." The MRI showed wasting away of the tissue in the part of her brain that controls vision, a problem that is not common in people Donna's age. Donna was sent for a neuropsychological evaluation, which consisted of several simple tasks. Can you draw a clock? Count backwards by 7, and repeat 5 words in order. Donna explained the tasks. You're like, whatever, and then you go to do it and you can't. I was frustrated and angry and embarrassed. I'm an intelligent woman. Why can't I do something a grade schooler could do? It was like my head turned into a solid concrete block. There was nothing going on. And when I forget something, it's not like it's in there somewhere. When I forget something, it's like I never knew it. Upon her diagnosis, Donna employed many coping strategies. She states that she could fake a lot of her conversation. She listens, smiles, and nods. She takes pictures of important things such as addresses and room numbers so that she can get to them on her own. If she gets lost, she calls Nick and gives him street names and descriptors, and he guides her. Her coping strategies became more and more difficult as her disease progressed. She also posts lists around her house to remind herself of where things go and what needs to be done. Donna would have Nick drive her to her job at a bookstore, and her sister would pick her up. She eventually had to leave the bookstore due to problems with getting lost in the store and losing her ability to add up a simple column of numbers. Donna's husband is her biggest support and the biggest source of help. Donna states to her husband during the interview, "You're like an anchor. Nothing is really certain but you. I'm not letting go of you."
When choosing an intervention for an individual who has dementia, it's important to keep it client-centered and specific to their diagnosis. This is an ASHA map that can be found online, and through our clinical experience, that we have found that the external memory aid and memory training programs are both very effective therapy techniques. In the following clip, you will see examples of both of these.
So today we're going to talk about a memory book, which is a compensatory strategy that kind of cues old memories. So it has pictures in it, it can have words in it, and it's basically just to cue those old memories that you have that are important to you. Two of the big hallmarks of a memory book are using errorless learning. So everything in this book will be specific to you and relevant to you. So nothing that you learn will be incorrect, or you'll be able to rely on this book, basically. And then the second thing is that it uses formulaic language, which these are like familiar sayings or words or phrases that will cue these memories and kind of remind you of those feelings that you have. These have also been known to decrease anxiety. So if you go to an unfamiliar setting, it's kind of like your security blanket almost, that you know that this will always be the same, and you can always cue these old memories and thoughts. And also kind of as to decrease anxiety in everyday life. So this is something that, Nick, I know you're really involved as her husband, that you can bring out if she's having stress because of something or anything like that, and kind of look over it together and remember these past memories. So is there any memories that come to mind immediately, Donna, that you would like to have in this memory book?
Well, birthdays are really important to me, and this past birthday I wasn't able to remember Nick's birthday, and that would be something that I would really like to know. Just remember, because I usually do something really big and go get cards, and he had to remind me of his birthday, and it was really frustrating this year.
Okay. And Miss Nick, is there anything that you would like in the book?
I would just say me as a person, and kind of like she said, dates are important to her. So our anniversary, or just little hobbies or things that we do together as a couple, just so she can remember our relationship and kind of the bond we have between one another.
Okay, why don't you also kind of think about this over the next couple days, collect some pictures that we can put in it, and we can work on this together at future sessions.
Awesome, thank you.
Sounds great.
So then should I just do like a little practice one?
Mm-hmm.
Okay, so something that we could do, because I know, Donna, that you've mentioned that you're really nervous that should something happen to Nick because of his poor health, that you would know what to do. So one of my questions could be, what do you do if you see that Nick is passed out? And basically, I'm going to help you respond, and I'm going to say you're going to call 911. I'll give you the answer at first. You're going to call 911, so you're going to pick up the phone and dial 911. Okay, so we can try it.
Okay.
All right, Donna, what are you going to do if Nick is passed out?
I'm going to pick up the phone and dial 911.
Good. And now we would wait 30 seconds, and I would ask you the same question.